dengue fever, climate change, and predictive modelling, an urgent call to action. We are Group 3 and here are our members. In this presentation, we will address the impact of climate change on infectious disease, specifically dengue fever, and the threat it poses to global health. We will also propose some potential solutions.
The World Health Organization has identified the dengue virus as a major public health challenge, particularly in tropical and subtropical regions. Between 1960 and 2010, dengue has experienced a 30-fold increase worldwide. This surge is attributed to factors such as population growth, global warming, ineffective mosquito control, and inadequate healthcare facilities. Currently, 2.5 billion people live in dengue endemic areas, with approximately 400 million infections occurring annually. In some regions, the mortality rate can exceed 20%. Dengue infection affects over 100 countries, and with predicted global temperatures increasing, its impact is expected to spread further. Climate change will likely exacerbate the effects of this virus. The virus is primarily transmitted among humans through mosquitoes. However, the disease can present asymptomatically, which complicates detection and increases the risk of spread.
According to the WHO, 1 in 2 or half of the world's population are at risk for dengue fever. Currently, there are no existing treatments. Over half of known human infectious diseases can be aggravated by climate change or have been at some point, including dengue. Dengue is now endemic in more than 100 countries in regions like Africa, the Americas, Southeast Asia, and the Western Pacific. So why is the vector spreading? Several factors are to blame for the spread of the vector, namely rising temperatures. The Aedes mosquito, which carries the virus, is extending their geographical range. They are now able to inhabit previously uninhabitable cooler regions. This could elevate epidemic intensity.
Climate change has a significant impact worldwide, including the proliferation of infectious diseases in tropical areas. Vector-borne infectious diseases such as dengue fever have spread rapidly due to the more suitable living environments.
Transmission of dengue virus basically consists of the ingestion of viremic blood from mosquitoes to a susceptible human host. Research has found that susceptible populations share a common geographical point, including areas with tropical climates. The population mainly affected by dengue includes adolescents and adults. However, it has also been reported to pose a significant threat to older adults. According to Zambrano-Orma 2016, another main risk factor for dengue is the lack of control measures and the accelerated increase of the disease in tropical countries, which makes all inhabitants of these countries susceptible to contracting the virus. Unfortunately, there's no safe method to eliminate the vector, which is why this disease continues to spread.
Studies have shown that dengue is the world's most widespread vector-borne disease and has had an increase in endemic potential. This means that a smaller number of mosquitoes can maintain a state of endemicity of disease where dengue is introduced. The World Health Organization reported an increase in cases from 2000 to 2019, with the largest number recorded last year, an astounding 4.5 million cases in the Americas region.
To propose solutions for dengue fever, we've identified several risk factors based on WHO guidelines that influence the spread of dengue, which are previous dengue infections, urbanization, and community awareness. Our solutions will target this at different levels. Firstly, we consider this in a global setting, where climate adaptation strategy will be essential. This can minimize the spread of dengue by shrinking mosquito habitats and shortening their breeding times. To be specific, keeping global warming to about 2 degrees Celsius, about pre-industrial levels, could reduce dengue cases by up to 0.8 million annually by 2050s, compared to scenarios with no climate policy and higher warming. This should be supplemented by effective urban planning, such as improving water drainage systems, which can significantly alter the water storage practices. This can be crucial to reduce dengue transmission.
In addition, we have community initiatives like the community engagement and monitoring and reporting. The first one is about education programs that enhance understanding of dengue transmission and emphasize the importance of eliminating mosquito breeding sites, like 10 Minutes Against Dengue campaign in Brazil. The second one is about volunteers. They collect data and report them to the local health authorities. Our specific solution is predictive modeling, where climate data, human mobility, and urbanization patterns can help us to predict dengue outbreaks. And we'll need 5 steps for our predictive modeling: the data collection, then the data analysis, where we'll try to find patterns and correlations. Third, the development of the predictive modeling using machine learning. Fourth, the implementation and monitoring. We'll implement this for real-time use. And finally, the continuous evaluation and improvement to ensure the model remains accurate and effective in the time.